What's going on, everyone? Dr. Taylor, Chiropractic. You ever get numbness and tingling in your hands? You want to know why? Let's talk about why. There are a bunch of different causes for the numbness and tingling in your hands, and I'm going to tell you right now, very rarely is it actually carpal tunnel syndrome. So when is that numbness and tingling going on in your hands? When is it not carpal tunnel? Let's talk about a few of them. So some simple anatomy here. If this is your skull, if this is your spine, you got 7 bones in your neck here. So let's just do 1, 2, 3, 4, 5, 6, 7, okay? And here's the rest of it going down there. Now, coming off of your spine is damn near every single nerve in your body. And the ones in the lower part of your neck are the ones that lead off of there and go down, they divide, they recombine, and they go all the way down into your hand here, okay? So we got that there. There's our shoulder. Boom. 1, 2, 3, 4, 5. There's our hand. So you come in, Doc, I've got this numbness and tingling going on in my hand. Everyone says it's carpal tunnel. Of course, everyone says it's carpal tunnel. Do you know why everyone says it's carpal tunnel? Because that's all everyone knows, right? That's the common thing that comes about. And why does carpal tunnel come about? Because so much of us work on computers. That is a direct cause of carpal tunnel. However, let's talk about the times when it's not carpal tunnel. Number one, and this is really common, carpal tunnel and something called pronator teres syndrome. Okay, so if we are looking at our arm here, so if we've got here's our upper arm right there, elbow going down into the lower arm, and then 1, 2, 3, 4, 5. Cool, got them all. So arm bone, humerus, forearm bones, radius and ulna. There's a set of muscles there. One in particular called your pronator teres. It goes across like this. Let's do this. Let's redraw this, make it bigger. What we're going to do here, we are looking at the forearm. So if we've got our arm bone, our humerus, boom, cartoon arm bone. And then we come down here, radius, ulna. There's 2 muscles there, pronator teres, and then we've got another one going on down here. Muscles only pull, right? So when that thing pulls, it rolls your hand over. Muscles are dumb. They only do what they're told, and they only know 2 things. Whether to be long, if we're talking about our bicep here, or whether to be short. Talking about our tricep, whether to be long or whether to be short. Or we're talking about this guy here, your pronator teres. It's long, it's short. People that have it stuck, quote unquote, in a shortened position are going to be people who work on computers a lot and people who grab things like, barbells and things like that. Now, we talk about the nerves here. We got one particular nerve that comes down here and goes right down the middle of your forearm. Okay, it's called your median nerve. And it crosses right underneath, too many markers, crosses right underneath this pronator teres. So what happens? You have a lifestyle in which your hand is rolled over like this a bunch. That muscle there gets used to being short. A short muscle is a contracted muscle. A contracted muscle will take up more space. Generally speaking, it's flexed, right? It's a flexed muscle. It's bigger. So when this hand or this forearm here is rolled over, that muscle right there, your pronator teres, gets short and fat. And then it starts to pinch on that nerve, the median nerve, whenever it's in this position, this supinated position. Starts to pull back like that. And what it does, it's going to pinch on that nerve, on that median nerve that goes into your arms, hands, and fingers, and it's going to cause that numbness and tingling. Now, the wonderful thing about anatomy, whoever designed this skin-covered meat sack that we walk in, if this is your hand, thumb, pointer, middle, ring, pinky, this thing's got, generally speaking, some really easy delineations to figure out. There's certain nerves that go to half of your ring finger and your pinky. There's certain nerves that cover the rest of your fingers. There's one that, covers half of the thumb, goes up into the forearm. So depending on where that numbness and tingling is, will tell us what nerve is compressed or is entrapped. And that's going to be that thing right there. Easiest way for you to tell, poke around in there and just roll your thumb or roll your hand in there, roll that wrist back and forth, and you'll be able to find a couple of trigger points that are going on, and it might even reproduce or recreate that numbness and tingling you have happening. Number 2, You clear this up here. Let's keep a little checklist here. We've got number 1, pronator teres. Number 2, we're going to talk about the thoracic outlet. So basically, everything going on up here in your neck, see, there's your super long neck. Everything goes through a little space right here in the front of your armpit. Shoot, maybe about the size of a $50. And when I say everything goes through there, I'm talking about all the nerves that go into your arms, hands, and fingers. All the blood vessels that go down into your arms. So if we're talking about muscles again, we're going to draw this up here. Here's your cartoon arm bone again. This is the upper arm. Again, we're going down there. There's the forearm. We already talked about that. Right through here, we got our ribs kind of coming around. And we've got our sternum right here. There's a gigantic set of muscles in there called your pec, right? Your chest muscles. They attach from your sternum, and they go right out here and attach into your shoulder. Basically, what's called the proximal aspect of your humerus. Again, muscles only pull. So that big pec pulls that arm forward, okay? And all those nerves and all those blood vessels that we're talking about have to go out of the neck here, and they tuck underneath that pec muscle. So we've got the nerves going through there. We've got our arteries going through there. We've got our veins going through there, carrying blood back to the heart. All that stuff tucks right underneath that pec. And again, back to what people do for a good majority of the day / their life is they're forward, okay? Just like that pronator teres gets short, gets contracted, gets flexed and tight, takes up more space. Same thing goes for the pec. So much of our life, we're here on our phone. We're at computers. We're at our car. We're this, right? All this stuff gets crunched up, and that little silver dollar, $50 size outlet, the thoracic outlet, gets super tight because those pec muscles in there pull those shoulders forward. That's going to pinch on those nerves. That's going to pinch on those blood vessels. That's going to potentially cause numbness and tingling in the arms, hands, and fingers. So that there, thoracic outlet syndrome, TOS. Number 3, and in all reality, this is the most common one, subluxation, SUBLUXATION, sub, less than, lux, light, life, energy, less, light, life, energy going into the body. Subluxation of the cervical spine, T1, C7, 6, 5, where those nerves originate, those bones, now we're looking at you from behind, those bones get bent, torqued, get bent, torqued, or twisted. And what do? They put compression on those nerves where they exit the spine. So if we take a peek here, we blow up the picture into something like this. We've got our spinal cord going down our spine, and we've got those nerves that come off in between the vertebra. Just these 4 here. Which one do you think is going to cause a problem? That guy right there. And again, it all goes back to what are the symptoms like that you're presenting with? Is it part of your hand that's numb or tingling? Is it your whole hand? Does it kind of start at the elbow and work its way down? This is the most common source of that numbness and tingling in the hands. Because again, every nerve in your body originates from your spine, save for just a select few of them. So if we've got subluxations in the low neck, we've got bones out of place, lost juxtaposition from the bone above or the bone below, causing stress, trauma, pressure on those nerves, you're going to feel the symptoms a lot of times wherever those nerves end. Because those nerves go to every cell, muscle, and tissue organ in your body. Not a whole lot of organs, if you will, going on down in your hand, but there's definitely sensation. So if you get a bone out of place in your neck, pinches that nerve, you're going to feel those symptoms wherever that nerve ends. And again, in this particular video, we're talking about the hands, so you're going to feel those symptoms in your hands. That's going to be that numbness and tingling. It's going to be loss of grip strength or something like that. Maybe they might even feel cold. You kind of got to shake them out. So, forearm, how do you fix it? You got to release that muscle. Thoracic outlet syndrome up in here. How do you fix it? You got to 1, release these muscles here, but 2, strengthen the muscles in your back, right? Get those things pulled back. How do you fix the subluxation of the neck? Easy. You come and see me. because there is nobody around here that's as good or better than me at fixing this kind of stuff going on here. Bones in the spine, out of alignment, causing distress, dis-ease, dysfunction on the body. You pinch that nerve, you're going to have symptoms. So here we're talking about stuff going on in the neck. This is literally the same thing as sciatica. What is sciatica? Sciatica is inflammation of nerves coming out of the low back that create that sciatic nerve going down the leg. Don't Google this, but this is basically sciatica of the neck. Sciatica of the neck's not a thing. Don't Google it. But for analogy purposes, that's exactly what we've got going on here. So, Doc, I've got numbness and tingling in my hands. Okay, is it pronator teres? Maybe, in the forearm. Is it thoracic outlet syndrome? That's a real good thing to start out. Start releasing those pecs, start strengthening and activating those back muscles to get those shoulders back. Is it a subluxation? That's a real good idea right there. Because again, that is the most common thing that's going to cause these nerve issues going on in the neck, causing those symptoms that you're feeling in your hands. How do we fix it? Muscles, stretch them out. Muscles, stretch them out. Subluxation, I'm your guy. It just so happens I'm the guy for the most common cause of these symptoms you got happening in your hands and fingers. So, if this sounds familiar, if this is something you're dealing with or something that you know somebody else is dealing with, you know anyone that needs this kind of assessment that we can help, send them in right through that door. We'll help them anytime you guys show up right here to Chiropractic, where we're ready to help you when you're ready to be your best. Naturally.